Good afternoon, everyone. This is Mahdi, this is Hadi, and this is Michael. Our topic for today's presentation is perioscopy. Perioscopy or periodontal endoscopy is a minimally invasive procedure that uses a tiny endoscope with magnifications usually ranging between 24 to 48 times. This endoscope goes below the gum line, or as they say, subgingivally, and provides a direct real-time visualization of that area on a video monitor, as seen on this picture. The thing that sparked our interest was the fact that despite its decades of existence, it is still not widely integrated into mainstream practice. We wondered, could this be a game changer for us future dental hygienists? With that in mind, let's dive into our objectives and goals. Firstly, we wanted to examine the evidence comparing perioscopy-assisted subgingival debridement to traditional debridement, where you rely on your experience and tactile detection alone. Is perioscopy more effective? Does it improve the accuracy and completeness of calculus removal, not only for registered dental hygienists, but also for us students if used in an educational environment? Since perioscopy is something that falls under the scope of practice of dental hygiene, we wondered if this could be a more gentle alternative to open flap surgery, which is something that we can't practice as dental hygienists anyway. Also, can it improve the outcomes when used alongside some adjunct therapies? Last but not least, how does it correlate to one of our most important practice philosophies? Is perioscopy patient-centered? With that being said, I will hand things over to my friend Hadi.
Thank you, Mahdi. All right, I'm going to be going over periodontal endoscopic debridement and how it compares to other periodontal therapies. I'll also be discussing some educational outcomes as well. First off, we reviewed a meta-analysis. The author of said analysis did a comprehensive research across several major databases, such as PubMed, Medline, etc. He tried to show that the effectiveness of endoscopic debridement and only went as far back as December of 2024. They specifically focused on randomized clinical trials that compared endoscopic debridement to root surface debridement and access flap surgery. They had two independent reviewers that assessed the risk of bias and data extraction. Overall, 5 clinical trials were concluded, involving 155 subjects and over 4,000 periodontal sites. Well, what did the results show us? Well, there was a significant higher probing depth reduction compared to root surface debridement, and that 6 months post-operation, a significant change in CAL, clinical attachment level, in favor of endoscopic assisted debridement. In the article, there was also no significant difference observed between endoscopic debridement and access flap surgery, meaning that endoscopic debridement is a less invasive alternative for us as dental hygienists to practice. Now, let's talk about some education outcomes. Through the studies that we reviewed, students that received feedback with endoscopic instruments showed higher improvement in calc detection and removal skills than those without. Due to that evidence that was shown across all 2 surfaces, we can deduce that enhanced visualization helps increase instrumentation skills. And let's face it, we are all visual learners, so this can be crucial to any future hygienist. And with that, I'm gonna hand it off to Michael.
Thank you, Hadi. All right, so after seeing the effectiveness of endoscopic assisted debridement,
we wanted to explore whether adjunct regenerative therapies could even further enhance patient treatment outcomes. Specifically, we looked at platelet-rich fibrin. Now, the review and analysis that we went over had adult patients that were 18 years of age or older who were also diagnosed with periodontal disease. The researchers had two groups, a control group with patients that underwent subgingival root debridement alone, and a test group that underwent the same subgingival root debridement, but they also added the platelet-rich fibrin as an adjunct therapy to that treatment. In order to measure whether it was effective or not, they looked at various different parameters, including probing pocket depth, CAL, bleeding on probing, gingival recession. Basically, you name it, they measured it. Some studies even went as far as looking at immunological markers to study whether there was a host response to that treatment as well. Now, one of the specific measurements that we wanted to hone in on was clinical attachment loss. There was a mean difference in CAL of about 1.34 millimeters in favor of the test group. Now, this is huge because when we're talking periodontal disease, every 10th, heck, every 100th of a millimeter is vital to the patient's treatment outcomes. But how does perioscopy help further enhance this treatment? Well, regenerative therapies, much like platelet-rich fibrin, are wonderful because they stimulate tissue healing and periodontal regeneration. However, they rely heavily on proper root surface debridement prior to that treatment. They need to prepare that root surface properly. As we have seen, that's exactly where the endoscope shines. By providing the clinician with a direct visualization of that root surface, we're able to provide a more effective root surface preparation prior to that regenerative therapy. This could even further enhance that treatment, allowing platelet-rich fibrin or any regenerative therapy to be able to perform at its maximum capacity. And who would benefit from that? Well, the patient. And that's exactly why we're so excited about this type of treatment. You see, overall, we've seen that the evidence shows that endoscopic assisted debridement is superior to standard root surface debridement alone. Not only that, but in some situations, it's shown to be as effective as access flap surgery. But, and this is the key point, it's able to do so without the need for an invasive surgical procedure, which would fall under the scope of practice of dental hygiene. Now, this type of treatment supports the concept of minimally invasive dentistry. But why is that important? Why should we care? Well, I'll give you 3 words: patient-centered care. I guarantee you that if you ask any of the dental hygiene students here today what patient care is and why it's important, they'll give you an answer like that. Why? Because patient-centered care is a core practice philosophy, not just here at Hudson Valley, but a core practice philosophy for all practicing dental hygienists. You see, we strive to be able to provide the most effective and efficient treatment possible while minimizing patient risk and damage. The truth is, minimally invasive dentistry is patient-centered care. Now, enhanced visualization tools, much like the endoscope, allow us to be able to open up a world of treatment combination possibilities, being able to, the clinician, to be able to provide different treatment alternatives to our patients. But in order to be able to do so, we must be willing to elevate our skill levels. I'm certain that practicing clinicians, much like us students, we are constantly making sure that our skills are never the limiting factor in our patients' treatment outcomes. I'd like to take this moment to thank all of you for being here today and taking the time to stop at our booth and listen to our presentation. At this time, we'll take any questions and we'll be happy to try to answer them to the best of our ability.